Every time I go on the interwebs, there seems to be an ongoing battle between manual therapy providers as to what is the best and most effective treatment method to apply to a chronic injury with the hopes of getting long lasting pain relief, with each provider believing their treatment to be superior and that any other provider is absolute garbage. In this episode, I dive into the concept that a chronic injury needs a team effort, but making sure that the first provider does quality soft tissue based treatment is the key to achieving long lasting pain relief. I hope you gain some new ideas and perspectives from the show. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach massage therapists a new treatment system that eliminates the frustration of not getting consistent results and produces long-lasting pain relief for their clients, all while working 50% less. If you're new to the show and you have no idea as to who I am, my name is Dr. Matt Maggio, and I got my degree in chiropractic well over 15 years ago, but I've never performed an adjustment in practice, and I focus my treatments solely on doing quality soft tissue-based work. And I believe that the best and safest treatments in the world to fix injuries and help people get out of pain are soft tissue treatments delivered by world-class massage therapists. Thanks for stopping by and checking out the show. Seriously, can't we all just get along? It's crazy what I see on the internet and the bombastic way that people talk to each other. I see these battles and these debates going on. A lot of times it's usually a physical therapist debating with either a chiropractor or a massage therapist and really trying to take the role of like superiority and that they're the best in what they do. And everyone's just arguing and there's too much nonsense going on. But I used to be part of that too. I would love to get into debates and discussions online with other providers, specifically physical therapists. You know, they'd ask like, where's your triple blind placebo study and all sorts of stuff. And they'd be like, just curious, why do you do this? And what about this? And we'd go back and forth. At the end of the argument or the discussion, someone would be called a name. Bad things would be said, be like, I feel bad for your patients, I feel bad for your clients, blah, blah, blah. And we never got anywhere. And then you're out of that time and nothing got better. So I always talk about this and I want to make it clear again. The context in what I'm talking about, whenever I'm talking about a practice, an injury or a treatment, I'm talking about chronic pain treatment. That's what I do in my clinic. That's what I teach. That's what I share. I'm talking specifically about treating chronic pain. And for me, chronic pain that I want to see in my office has been going on for at least 6 months. I usually don't want to see like an acute injury because there's a lot more components in there. And also, I ideally want to see like no direct trauma or mechanism of injury. A lot of times I want to see like a compensation where it kind of came out of nowhere and just kind of built up over time. That's right up my alley, and it will respond really well to the type of treatments that I do. Here's another issue. Not everything is just soft tissue or fascia. I see this all the time, especially massage therapists make this mistake, and I did for years too. It's like, oh, it's all this, especially the fascia people. They're like, everything's fascia, just treat the fascia. I saw one the other day. It was like, all your trauma and your past life experiences are held in your fascia. Sure, I guess so, but it's not just that one thing. There's other things you need to treat as well. I talk about this idea when a injury comes into you in chronic pain, there's 4 components that we must first look at. The first one is going to be tissue. That's going to be your soft tissue. It's going to be your muscles, going to be your ligaments, going to be nerve entrapments. Next is going to be your structure, which is going to be like your bones, your cartilage, your disc, your tendons. Next is going to be the metabolic presentation. Like, is this client inflamed? Do they eat like crap? Are they stressed to the max? Do they smoke? Do they drink? All sorts of stuff. And last one's just going to be psychosocial. Like, where's their headspace on this? Or like, they delusional? Are they crazy? Are they reasonable? What's going on? Are they, when people are in chronic pain, it really messes with them. It can make them bitter and defeated and all sorts of things. So you want to be able to address all of those concepts in there. We do a full breakdown in all of our trainings in that, where I really dive into how to recognize all the components so you can get successful pain relief for your chronic pain clients. All the information for those trainings is, in the description boxes below or wherever you're consuming this episode. Next is just this idea of like order of operations in treatment. I always say, think of the injury and the chronic pain as like a really bad house that we need to tear down and then rebuild back up. So the first thing we need to do is we need to restore range of motion. So my belief in what I've seen in 15 years of practice is that over time, the muscles and the ligaments develop, well, you can say the fascia too. I don't want to leave the fascia people out. They develop this stuff called adhesion, also known as scar tissue. It's like a glue that gets inside the muscle. And the first thing it does is it makes the area less flexible, and then it gets stuck to the nerves. And then that really limits the range of motion. Then as that adhesion builds up over time, it starts to weaken the area. So then what we need to do is we need to balance the strength and build back up that tissue as we go. Then lastly is we need to just get stronger overall. That's with like global movements like carries, pressing, squatting, lunging, things like that to increase the strength. So when I break that down in my clinic, this is how I look at it. I look at it in three phases. The first phase is what I call repair the tissue. With that one, we're going to be doing hands-on and instrument-based treatment to break down the bad tissue. When we do that, that restores blood flow and function to the area. This definitely should be done by massage therapists and people that only do strictly manual therapy, that go in there with their hands are able to actually affect change in the tissue. Usually not done really well by PTs or chiros or athletic trainers. Sometimes personal trainers try to do it as well. This is where we come in. We have to be the first person they see because we're going to restore the range of motion by getting that tissue repaired and getting it in a good place. Next thing we need to do is we need to heal the tissue. Once we start to repair the tissue, we got to heal it because it's been inflamed, it's been really beat up. This is where lifestyle, diet, stress management, etc. comes in. You can try to do this one on your own in your practice. I do some basic stuff with this with like hydration recommendations, some supplement recommendations, food recommendations, getting them to eat more protein, less garbage. But I found that it's better to outsource this to someone else, specifically like a nutritionist or maybe like a functional medicine doctor, because that's what they do. It's in their wheelhouse, and they're going to help the client like stay more accountable too. I also don't like to do this right away because the client is going to start to feel a bit better and function better as they start improving their lifestyle. And then they're going to think it was all that, and then they're not going to actually see the tissue get cleaned up, and this problem's going to come back down the road. But if you can refer this out to a nutritionist, it's someone really good that you can work with, and you can build like a reciprocal relationship back and forth, because a lot of times they're probably going to have people in chronic pain as well that might need treatment as well. And then the last step is we need to strengthen the tissue. First, we need to do a corrective part to help with the compensations. Then we need to increase the overall strength. You can do the corrective exercises yourself in your office. I do that sometimes, and we have videos and trainings that we give directly to the client. I don't really like to do it that much because I'd rather just get in there and treat the tissue and then have them go see someone else. So I do prefer to refer these out to other people, but I like to do it in this preference. Number one, the first provider I want to refer to is actually going to be a personal trainer. I like working with them because they're not in like direct competition with me as a physical therapist. And they're actually really good at doing that type of stuff. And there's like a bonus here as well. They can be a good referral source back and forth. So like you could send them a couple of your clients that are on the back end and need to get strengthened. And I bet they're going to have clients that are in pain and not functioning right, and they can send them to you. So it builds like a really good reciprocal relationship back and forth. And it's good for everybody. I built all my practices up like that by just having a couple of good local providers I work with, and we just kind of feed each other back and forth. You can send it to a physical therapist as well, as long as they're not like one of those jerks and think they're amazing at soft tissue work and think they're, the best of the best. And they always do evidence-based types of treatments. Or if they do soft tissue work, they're really bad at it. But their favorite type of soft tissue work is just dry needling, just jamming some needles in the area that hurts and hoping and praying that it actually gets better, which doesn't actually work. So I don't really like to work with a physical therapist if they're trying to like dabble in everything. If they're specifically doing corrective exercises and strength, yeah, they're good. They're good to work with as well. But a lot of times you're going to run into some problems with them where they want to be the first person. They want to be the most important person in the injury, and they want to do it all. And lastly, just a point of advice to save you some headaches. Don't argue with people on the internet, especially physical therapists. I've been down that road. It stresses you out. You get mad. No one ever gets any better from it. And then you waste your time, you waste your energy when you could be focusing on getting your own treatments better, helping more people, helping more clients. So stay away from that. At the end of the day, what I want you to become is a soft tissue treatment gangster. And there's a quote from Meek Mill, the rapper, in an amazing song called Dreams and Nightmares. And the quote is, "Gangsters move in silence, and I don't talk a lot. At the end of the day, your results are what matters, and that's all that matters." That's all I got in the episode. I appreciate you watching or listening. And as I close out every episode, go out there and be great this week. The world needs access to your amazing treatments so they can stay the hell away from the traditional medical model of pain pills, injections, and surgeries that only make things worse and ruins people's lives. I appreciate you checking out the show, and I will catch you on the next one.